Hi, my name is Jessica Hall. I'm 38 years old. I live in Los Angeles, California, and I am a TV and radio personality. I have two kids, Jake and Sophie. They are 4 and 6, and I've been married now for 14 years and with my husband for 18. My role as a mother is a nonstop job. It is 24/7. I love it. I wouldn't have it any other way. I'm the second oldest of 10 kids in my family, so I think it just came so natural to me to be able to be a good mom and know what kind of mom I want to be. And I waited to have kids. I had them at 32 and 34, and I love being their mom, and it's just kind of a natural thing for me. One thing I feel like people don't talk about is the aftermath of breastfeeding. I breastfed both my children, Sophie for 9 months and my son for a little over 2 years. I can't even tell you what my boobs looked like at the end of breastfeeding, when they weren't full of milk, and what was just left was, I was sad. I looked in the mirror and I did not even recognize myself, and I knew what I did was so good for my children, but also, what about me? And that was a big reason why I decided to seek breast augmentation. When talking to my surgeon about what look I was going for and what I wanted, I just wanted that fullness back. And I was a little nervous about putting, implants in my body or even going under. Like, I had a lot of concerns, of course. I think anyone would. But he made me feel so comfortable. We talked about what kind of implant I wanted. We talked about how the surgery is going to go down. He just made me feel really comfortable, and I got excited. I went from nervous to getting excited. My surgeon had the Natrelle implants in his office, so I was able to just put them in my bra and just kind of see how they would look, like the size, and they were just great because I was able to touch and feel like what is going in my body. My surgeon showed me 3 different implant options, and I didn't know much about the actual implant at the time. After my consultation and talking about it, of course I went home and did my research, but just from the feel of all 3 different ones he chose for me to look at, I immediately went with Natrelle just because of the way it felt and the look of it, and I was drawn to it. My surgeon told me many things not to do after I had the surgery. He told me not to lift my kids, which was hard because I think Jake at the time was like 2.5 years old, and to take it easy, which is incredibly hard for me. He also told me not to work out for at least 6 weeks after, and that was no problem. I had many of my mom friends ask me about my surgery and how I selected my implant and the recovery. There are so many women that aren't as comfortable with their bodies anymore, especially after having kids and age. And I'm glad that I can just be open and honest about it. And I cannot say how happy I am and just how much I like wearing clothes and looking in the mirror and getting out of the shower and not hurrying up and putting a robe on. So in the end of the day, it was the best decision for me. And I know that there's so many others out there that want to do the same thing, but maybe a little afraid to take that next step. But I want to be able to let them know that it's liberating, and it's okay to do something for yourself. We get lost so much with being a wife, working mother, and you don't think about yourself. And there were so many times that I was like, oh, I can't do this because I can't take this time off, or I can't lift my kids up for a week. And I always put everyone and everything else first. And this time I just put myself first for a short amount of time, but now I feel like I can just do anything now. And I am just so incredibly happy with my results. And to be honest, I wish I did it sooner. See, I enjoyed, alone time with my husband. And I know that sounds probably like too much TMI, but it's something that's important, especially being in a marriage for so long. Like, it was just getting dressed for the day. I found myself, not just putting yoga pants on. Like, I could actually wear these items of clothes that I had for so long that just would never fit properly because of my boobs before. So after having this breast augmentation, clothing is it's just a new world now. It's just so much more fun. So I wanted to let my followers know. I wanted to let people know my podcast. I don't care. It's okay to do something for yourself. And it's okay to let people know so others don't feel so guilty of thinking, oh my body didn't look like that, or oh my gosh, like, it's because my body didn't look like that either. I had some help, and I'm so grateful that I did, and I just want to let them know the truth. What keeps me going is the power of family, community, my kids, and me.
Natrelle Breast Implants, important safety information and approved uses. Breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. Breast implants have been associated with the development of a cancer of the immune system called breast implant-associated anaplastic large cell lymphoma, BIA-ALCL. This cancer occurs more commonly in patients with textured breast implants than smooth implants, although rates are not well defined. Some patients have died from BIA-ALCL. Patients receiving breast implants have reported a variety of systemic symptoms, such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. Individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution of symptoms when the implants are removed without replacement. Who can get breast implants? Natrelle breast implants are approved for the following: breast augmentation for women at least 22 years old for silicone-filled implants, and for women at least 18 years old for saline-filled implants. Breast augmentation includes primary breast augmentation to increase the breast size and revision surgery to correct or improve the result of a primary breast augmentation. Breast reconstruction. This includes primary breast reconstruction to replace breast tissue that has been removed due to cancer or trauma, or that has failed to develop properly due to a severe breast abnormality. This also includes revision surgery to correct or improve the result of a primary breast reconstruction. Who should not get breast implants? Breast implant surgery should not be performed in women with active infection anywhere in their body, women with existing cancer or precancer of their breast who have not received adequate treatment for those conditions, women who are currently pregnant or nursing. What should I tell my doctor? Tell your doctor if you have any of the following conditions, as the risks of breast implant surgery may be higher: autoimmune diseases, example lupus and scleroderma; a weakened immune system, example taking medications to decrease the body's immune response; planned chemotherapy or radiation therapy following breast implant placement; conditions or medications that interfere with wound healing and blood clotting; reduced blood supply to breast tissue; clinical diagnosis of depression or other mental health disorders, including body dysmorphic disorder and eating disorders. Those with diagnosis of depression or other mental health disorders should wait for resolution or stabilization of these conditions prior to undergoing breast implantation surgery. What else should I consider? There is a boxed warning for breast implants. Please see bold text at beginning. Many changes to your breasts following implantation are irreversible. If you later choose to have your implants removed and not replaced, you may experience dimpling, puckering, wrinkling, or other cosmetic changes, which may be permanent. Breast implantation is likely not a one-time surgery. The longer implants are in place, the greater the potential risk for complications. You will likely need additional surgeries on your breasts due to complications or unacceptable cosmetic results. Thus, you should also consider the complication rates for later revision surgery, since you may experience these risks in the future. Cancer treatments and surgery will affect the outcome and timing of breast reconstruction. Breast implants may affect your ability to breastfeed, either by reducing or eliminating milk production. Rupture of a silicone-filled breast implant is most often silent. Even if you have no symptoms, you should have your first ultrasound or MRI at 5 to 6 years after your initial implant surgery, and then every 2 to 3 years thereafter, regardless of whether your implants are for augmentation or reconstruction. If you have symptoms of or uncertain ultrasound results for breast implant rupture, an MRI is recommended. Additional imaging may be required depending on your medical history and status. The health consequences of a ruptured silicone gel-filled breast implant have not been fully established. Routine screening mammography for breast cancer will be more difficult, and implants may rupture during the procedure. Perform self-examination every month for cancer screening and ask your surgeon to help you distinguish the implant from your breast tissue. Lumps, persistent pain, swelling, hardening, or changes in implant shape should be reported to your surgeon and possibly evaluated with imaging. What are key complications with breast implants? Key complications include reoperation, implant removal with or without replacement, implant rupture with silicone-filled implants, implant deflation with saline-filled implants, and capsular contracture, severe scar tissue around the implant. Other complications include breast pain, swelling, asymmetry, wrinkling, rippling, implant malposition, nipple complications, hypertrophic scarring, and implant palpability visibility. Talk to your doctor about other complications. For more information, see the patient brochures at www.allergan.com/products. To report a problem with Natrelle breast implants, please call Allergan at 1-800-624-4261. The sale and distribution of Natrelle breast implants is restricted to licensed physicians who provide information to patients about the risks and benefits of breast implant surgery.